Hi, everyone. My name is Pamela Manning, and I am here today to just go over a very important topic that most nursing students do not understand. Now, I've been prepping nurses now for several years to pass their NCLEX, and one of the biggest reason why students that comes to me is missing the answer choices, getting the wrong things, is because they lack the understanding of Maslow hierarchy of needs. So I'm going to take just a few minutes to go over this particular diagram with you. And whenever you are working with a problem or a question that reflect priority, always think Maslow hierarchy of needs. So basically, if you read the question and the question is asking you what will the nurse do next, or which patient would you see first, or any kind of order of when you will do something, it is telling you that you need to reflect on priority, which you should think Maslow. So let's start about this bottom bar right here. I know all of you see this triangle, and a lot of times you hear ABCs, airway, breathing, circulation, basic needs, but what exactly does this mean when it reflects a question? Okay, so if you have a patient and the question is giving you a diagnosis, let's say the patient had COPD, and let's say the patient come to the doctor office because their spouse of 30 years just died suddenly, and they're agitated, they're upset, and they're just erratic. They're having a lot of respiratory issue at this time. You look at the SAT and it's low. um the diagnosis is saying COPD. Okay, this is where you're going to say, well, what exactly is the question is asking? So if the question said the patient has COPD, but now you have a problem like the spouse died, it's causing agitation, it's causing them to be anxious and going through a lot of hyperventilating and upset, of course, because they're so agitated, their oxygen level is going to decrease. Now, as a COPD person, their oxygen level is usually sat in low anyway. Their body already know how to handle the low oxygen. So you want to look at that, but you do not want to focus so much on COPD. What is going on in the problem is the fact that their spouse of so many years suddenly died. They're upset. So you want to calm that patient down first. So you are not thinking so much COPD. You're thinking up here, right? Love, belonging, right? Intimate relationship. So instead of thinking airway, which is down here, you want to go up here, okay? Because you're looking to see what exactly is the question asking, and not because it said the diagnosis is one thing, that do not mean this is what you need to be focusing on. Okay, so at any given time in a question, any of these areas can be number one priority, right? So think about what the question is asking and then focus on exactly what is being asked, not the diagnosis, but what is really happening. When they give you those little scenarios in the question, they're trying to paint a picture for you. So you want to think about what is going on and then focus on what the question is truly asking, and that will determine which of these boxes you're thinking. Are you thinking physiologic need? Are you thinking safety as the first priority? Or are you thinking self-actualization? So it all depends on what the question is asking, determine which one to pick. If you look over on this side of the triangle, it say basic needs. But if you look on this side of the triangle, it says survival and bodily comfort. What are some bodily comfort stuff? Using the bathroom, pain, right? So those are priority as well. So you want to focus on this side of the triangle and you want to focus on this side of the triangle. I hope this helps someone. And if it is helping you, please remember to like, please remember to subscribe, and please remember to share. You could visit my website and keep checking back because I'm going to be doing a lot of these short videos, and just tune in because I'm going to cover topics like cardiac, respiratory, and all different aspects, and plus other things that I wanted to take this YouTube channel to help others. Thank you very much. Again, my name is Pam.